a critically important muscle in stabilizing the pelvis and in stabilizing the hip joint is the gluteal muscles called the gluteus medius and the minimus, which occur just below the rim of the pelvic bone here. They reach downward toward the bony prominence that sticks out of the hip that we call the trochanteric. So they're in a fan-like shape this way, and they provide stability for pelvic movement side to side, up and down, and they stabilize the hip joint itself. And the true hip joint, or coxofemoral joint, is technically located right here, more or less in the groin. So the ball and socket of the leg joining the pelvis, this hip joint is right here, and the gluteus medius plays a role in all hip joint and pelvic stability. It very frequently is weak, and this exercise is the beginning stage of exercising and recruiting better strength and activation of the gluteus medius and minimus. It's called the hip hike, and in this case the goal is to work the left gluteus medius, and in doing that we're going to hike the right hip so it looks like this. So even though we're lifting the right limb, we're working the left gluteus medius, which is lifting the opposite side of the pelvis. So all the legs, both left and right, are perfectly straight. We're not bending the knee or the ankle. We're basically lifting this hip, and we're only raising it perhaps an inch, but the foot does or should clear the floor. We're essentially closing the distance between the top of the pelvic bone and the lower ribs. So we're closing this distance, and we're not leaning the torso. The whole body skeletal system is remaining quite vertical, although we are holding on with the left hand, in this case holding a counter or back of the chair or some other object. Another way to think of this is that we're trying to suck, in this case the right hip, the ball deeper into the socket. So that's another way of thinking about it. We're trying to pull the ball deeper into the socket. We're trying to lift this side, and it would look like from the back side. In the process of using this muscle, we are also recruiting some back muscular effort, but that's unavoidable. As far as repetitions go, it's better to underdo and work up very gradually. Depending upon your level of pain and conditioning, I would start with anywhere from 3 to 10 elevations, and then try to do this 1 or 2 times per day. And I would gradually increase the number of repetitions based upon your strengthening and any residual soreness that you might encounter the next day. Most of the soreness usually occurs from this recruitment of the back muscles, so we don't want to overdo, but at the same time we want to engage these muscles to lift the opposite side of the pelvis.